Chemoimmunotherapy is the most common standard of care for patients with newly diagnosed high tumor burden follicular lymphoma, but CD3, CD20 bispecific antibodies are challenging the role of chemoimmunotherapy and could delay or even obviate the need for chemotherapy in this disease in the future. Epcoritamab is a CD3, CD20 bispecific antibody that is already approved for patients with relapsed or refractory follicular lymphoma. And at ASH this year, we presented data from a phase 2 trial that is combining rituximab and epcoritamab for patients with newly diagnosed high tumor burden follicular lymphoma. In the trial, patients receive 4 weekly doses of rituximab before the first full dose of epcoritamab is given, and epcoritamab is continued as a monotherapy for a total duration of treatment of about 9 months. We hypothesized that pretreatment with rituximab could both lower the risk of cytokine release syndrome and also deepen responses. 35 patients were enrolled on the trial at 3 different U.S. cancer centers, and these patients had frequent high-risk features, including approximately 60% of patients with a high-risk FLIPI score. So far, 30 of these patients have completed treatment. We've observed very high response rates with a best overall response rate of 97% and a best complete metabolic response rate of 94%. And with approximately 1 year of follow-up, only one patient has progressed, yielding a 1 year progression-free survival of 97%. In addition, the toxicity profile for this combination was manageable. Cytokine release syndrome, or CRS, was the most common side effect, occurring in about 45% of patients, but was almost entirely grade 1, with only 2 cases of grade 2 CRS, suggesting that pretreatment with rituximab may lower the risk of CRS. Infections of any type were observed in about 60% of patients and were generally low grade, although 2 patients did discontinue treatment prematurely because of recurrent low-grade infections. Our results suggest that bispecific antibody-based frontline therapy is highly effective, and follow-up for these patients is ongoing. Based on these encouraging results, we have expanded the trial to include an additional 65 patients, and in this expansion cohort, we're making 2 changes to improve the tolerability and convenience of the regimen for patients. First, decreasing the frequency of epcoritamab dosing to every 4 weeks for the last 6 months of therapy, and second, reducing the steroids that are used to prevent CRS during epcoritamab dose ramp-up. We're excited to continue enrollment for this trial and look forward to sharing initial results from the expansion cohort soon.